After having COVID-19, a person may experience a number of long COVID symptoms that last for weeks, months, or even years. One of the many potential symptoms of long COVID is brain fog. If you or a loved one is experiencing brain fog as a result of prolonged COVID, you may be wondering when or if this symptom will go away. This is a question that doctors and scientists are still debating. And today we are here with a new topic: what long COVID brain fog is, and how long it might last. What is COVID brain fog? One of several possible symptoms of long COVID is brain fog. While brain fog is not a medical term, it is a phrase used to describe a variety of symptoms that affect cognition and memory, such as thoughts that can be described as sluggish or fuzzy, problems with concentration and paying attention, difficulty with decision-making or planning, trouble with memory, mental fatigue, and confusion. According to research, 43% of COVID-19 patients worldwide reportedly experience long COVID in some form. Additionally, they discovered that memory loss, a sign of brain fog, was the second most frequently reported symptom of long COVID, after fatigue. The exact cause of brain fog after COVID-19 is unknown. According to one theory, high levels of inflammation or immune activity in response to COVID-19 have an effect on the brain. However, more research on this topic is still required. How long does the typical COVID brain fog last? Since COVID-19 has been around for a few years, scientists have a better understanding of the disease's long-term effects. However, it is still unknown how long symptoms such as brain fog may last. Here's what some of the research says so far. Brain fog peaks in the months after COVID-19 then gradually decrease. A study in 2021 aimed to characterize long COVID symptoms in over 3,000 people from 56 countries. It accomplished this by requesting that participants complete an online survey. Researchers discovered that 88% of respondents had cognitive or memory issues. The likelihood of experiencing these symptoms increased in the first few months following the onset of COVID-19 symptoms and then began to decline. At the beginning of the 7th month, after COVID-19 symptoms developed, 55.5% of respondents reported cognitive issues. In addition, 50.5% still reported memory problems. People who had long COVIDs were asked to describe their experiences in a 2021 study. Most participants reported that brain fog appeared within the first few months of developing COVID-19 symptoms. Researchers contacted participants via email 4 to 6 months after their initial evaluation. Of those who responded to the follow-up, 65% felt their brain fog symptoms gradually improved. The signs of brain fog could continue for months. A 2022 study investigated how people with long COVID and neurological symptoms like brain fog recovered. The average time since the onset of participants' COVID-19 symptoms was 14.8 months. Following an initial assessment, researchers followed up with participants for 6 to 9 months. There was no significant difference in brain fog reporting at the follow-up compared to the initial evaluation. Despite this, participants did feel as if their cognitive function was improving. But the researchers still noted that quality of life measures in the study remained lower than those of the general population. What solutions are there for COVID brain fog symptoms? There is no tried and true method for reducing brain fog symptoms after COVID-19. Still, the following suggestions may be useful. Plan your days. Setting up a daily schedule and making goals for what you want to achieve each day may be helpful. Pace yourself. Try not to overwork yourself. If you're feeling exhausted or overwhelmed, don't be afraid to take a break. Be active. Exercise is beneficial to your overall health. It can improve your mood, improve your brain health, and reduce stress. Try to engage in regular physical activity most days of the week. Get enough sleep. Lack of sleep can have a negative impact on your health. Make an effort to maintain a consistent sleep schedule, and ensure that your bedroom is quiet, dark, and at a comfortable temperature. Eat a balanced diet. Try to eat a balanced diet. Because inflammation may play a role in brain fog, consider increasing your intake of anti-inflammatory foods such as tomatoes, broccoli, and fatty fish. Reduce stress. Long periods of COVID symptoms can be stressful. Consider stress reduction techniques such as breathing exercises, meditative walking, guided imagery, yoga, or even an enjoyable hobby. Maintain connections. Because social connections are important, take time to hang out with family and friends. Joining a support group for people with long COVID may also help you connect with others who are going through the same thing. It can be difficult to deal with brain fog, but patience is essential. You may need to try different combinations of strategies before finding one that best helps manage your symptoms. When to get care. Many people who suffer from brain fog as a result of prolonged COVID notice that their symptoms gradually improve over time. However, there are some indications that it is time to consult a doctor about your brain fog. Follow up with your doctor if your symptoms are getting worse, becoming concerning, or causing you notable distress, interfering with your daily life in a significant way. We're still learning the best ways to handle long COVID-related brain fog. However, your doctor can work with you to create plans that will enable you to control your symptoms better. The bottom line. Brain fog is a common symptom of long COVID. While it can gradually improve as time passes, it is possible to still have brain fog months or years after having COVID-19. Pacing yourself, getting regular exercise, managing stress, and getting enough sleep may help manage symptoms of brain fog. If your brain fog worsens or disrupts your daily life, consult your doctor. So that's it for today. Before you go, please don't forget to like, subscribe and turn on notifications for our channel, so you never miss what we post next. Thanks so much for watching.